Hi, this is a very short lecture on the vicarious trauma, compassion fatigue, and caring for caregivers and some of our related topics. What I intend doing is to start with the kind of terms that we already know, one of them being burnout. And when we take on a topic like burnout, uh, automatically it talks to us about the way we feel the fatigue, the way we feel tiredness, and the possibilities of feeling even sometimes a little bit of depression around the kind of work that we do, and maybe not really having much meaning at work. Certainly, a lot of us are highly committed and passionate about what we do and why we do. Many of us identify ourselves with our jobs, and the jobs do give us a meaning in our life. When we talk about our jobs, we talk about the inspiration that they give, the passion that we bring to our jobs, the compassion, which is very much a central element in our profession. But at the same time, we seem to be burning out. And why is definitely an important question that we need to ask. So, how do we recognize the signs and symptoms of burnout? And how do we recognize the symptoms of even compassion fatigue and vicarious trauma? One of the things that you can recognize easily in relation to burnout is the physical warnings that we get, the exhaustion that we feel, the tiredness. As an individual, we feel very, very tired sometimes. And the second signal that we also get is the emotional part of our being. We tend to feel more depressed. Maybe sometimes we feel guilty that we haven't done enough for the client that we wanted to do. Even sometimes unable to feel empathy towards people that we serve. That's a very strong way of putting things, that we don't have empathy for the people. But then I'll explain that further and in what situations something like that can happen. The third element that we need to understand is basically the behavioral or the irritation or anger. When we become teary, we start binge eating or numbing as we feel. I remember many, many stories, and in fact, I've witnessed it myself when in child safety. On almost on a regular basis, we used to look forward to getting out as a team. And yeah, I mean, I wouldn't say that we really got drunk, but nearly ensuring that someone can drive us back home. Now, what does that situation mean to us? How do situations like that, we get into situations like that? Why do we take to one of those coping mechanisms? Whether it is done in in short time, in a limited way, then there is some kind of a tacit approval. When it comes into becoming a habit, then certainly it is considered a negative coping mechanism. So all the three elements, the behavioral part, the physical warnings that we see, the emotional or the feelings that are generated as a result of our work, feeling guilty, unable to feel at home or at ease in relation to our clients, not having that kind of sympathetic attitude and an empathetic orientation towards the people that we serve. These are certain things that we definitely notice and we need to start worrying about. Now, what do we suggest? We suggest that we should check out with a close friend or even a colleague in terms of how we are traveling. Am I going okay? It's not a bad question to ask. Each of those sections in a pie that you have just seen, behavioral, physical, emotional, there are going to be some strategies to deal with. I think sometimes we feel as if we also need a 24/7 hotline call. The thought that a counselor needs counseling is just perfectly okay. If not for full counseling session, we need someone to debrief on that particular day. Now let us look at what those physical warning signs are. Exhaustion, yes, one can be exhausted. After a tiring day, after traveling 200 kilometers, dropping a child, coming back. Insomnia, lack of sleep, headaches, some sort of increased susceptibility to illnesses, sometimes sore back and neck, irritable bowel. It's also called the GI distress or gastrointestinal distress. Rashes, yes, breakouts, grinding your teeth at night, heart palpitations, hypochondria. There's a source there, a fantastic source. 10-Day Academy, have a look at that. That's very, very helpful. Now, what are the behavioral signs that we go through? Yes, people do take up to excessive alcohol and drinks. Anger, irritability at home and at work. Sometimes the feeling, oh, I want to avoid that client because I don't have an answer. I want to avoid a patient because I don't have an answer. Watching excessive amounts of television, Netflix at night. Consuming high trauma media ourselves because it's where we work. So we want to watch further trauma as entertainment. Start noticing those kind of things. Not returning phone calls at work or at home. Avoiding colleagues and staff gatherings. Avoiding social events. Some kind of an inability to make decisions. Feeling helpless sometimes when hearing a difficult client story because you already have some ideas from a previous story. All seem to be in a pattern. You don't want to believe that there's a pattern emerging. You want to live in a disbelief that everything has to be a different story. Feeling helpless, imposter syndrome, somehow feeling unskilled in your job. Problems in personal relationships, even difficulty with sex and intimacy due to trauma, exposure at work. Thinking about quitting your job, quite natural. If it is hard, becoming hard and harder, you don't know how to deal with it. You automatically think in terms of, I wish I had a better job than this. Compromised care for clients, patients, engaging in frequent negative gossip, unable to do certain things, blaming someone or the other, venting at work, and certainly either unable to eat well or go ahead and have more chocolate, binge eating. So then there are other things too. We talk about emotional exhaustion. It's about it's also about a negative self-image, depression, increased anxiety, difficulty in sleeping, impaired appetite, binge eating. That's what we talked about. And we also talked about reduced ability to feel sympathy and empathy towards our own clients, becoming cynical at work, saying nothing works, anger at work, resentment of demands being put on you at work. Do I have to do that? Can I do it tomorrow? Procrastination, postponement, dread of working with certain clients, patients, certain case files. They don't enrich you. You want to be away from them. But that's part of our work. A diminished sense of enjoyment. Thinking in terms of careers, low compassion, low satisfaction. A kind of depersonalization if you start moving into a feeling where we feel that we're not valued anymore. It's a kind of a thing where you feel you're kind of spacing out during work or driving home. Your worldview of what you had in your mind is disrupted. There's a heightened anxiety whether you'll be able to do well or not. Anxiety, irritation, and fear. Now, these are part and parcel of our emotional, psychological signs, hypersensitivity to emotions, the charged stimuli. We have an insensitivity to emotional material numbing, difficulty separating personal and professional lives, and failure in a way to nurture and develop your own friendships beyond work, non-work relationships, non-work related aspects, and finally, suicidal thoughts, suicidal ideation. I think these are very, very important for us to understand that burnout, compassion fatigue, vicarious trauma, all these kind of interrelated, different meanings at different times, different strategies at different times, but we all go through them and we need to work through them. And that's one of the important things that we'll be looking at. Now, this is a Venn diagram that you can see. The multiple exposure increased risk diagram. It's a wonderful diagram from the source that I've given there. It talks about individuals' personal vulnerabilities, the kind of socio-cultural context in which we are, the working conditions in which we work, possibilities of considering systems failure to support us. How do we go through the work-related trauma and grief and loss? What happens to direct exposures? The ambulance drivers, workers in ambulance, on their hand, if somebody passes away, which might be many, many times, that's a direct exposure to accident, a direct exposure to child abuse, indirect exposure to indirect traumas. The empathetic strain, the strain itself on your empathy, and the difficulty with which you are able to talk through empathy. These are very, very important. In tomorrow's lecture, I'll be detailing some of these things and look forward for all of you to listen to tomorrow's lecture. Thank you.